Hello and welcome to Matters That Matter. We have previously covered two procedures that often come out in OSCEs as well as in PLAB, that is the cervical smear and venipuncture. Today we'll be looking at IV cannulation. So let's dive into it. Now I'll be explaining to you about the procedure, how to arrange the trolley, how to perform the test, and how to end the OSCE. What are some indications for IV cannulation? If ever you need to give IV fluid to the patient, for example, the patient might be dehydrated or maybe pre-operative, hence you need to give IV fluid to this patient, or maybe that the patient is on total parenteral nutrition, so you will provide his protein, his calories through this IV line. For drugs, medications, or even to take blood samples in patients that are admitted in the hospital. There are different sizes of IV cannula, and you have different uses, the flow rates. In this table, it is all summarized. The size of the IV cannula ranges between 14 to 26 gauge. 14 being the widest, and 26 being the thinnest diameter. As you might also be aware, you have in emergency, in trauma cases, the need to use large bore cannulas, and these large bore cannula are often of grey, and sometimes even the green color cannula can be used in traumatic cases. Very rarely the orange one is used because it is so thick that it can damage the vein, and of course large bore cannulas are painful. Usually the commonly used cannula is the green or pink one. Pink one is commoner, but if you go towards the pediatric age groups, then it's usually the yellow and the purple one that are used. There is one more cannula, that is the white cannula, which is quite rare. It is a new one. Talking about the procedure now. Before carrying out the procedure, introduce yourself. Ask the patient if the patient is comfortable or in any pain before and during the procedure. Ask for their consent. So the consent is asked after having explained to them what does the procedure consist of. So what is IV cannulation? How would you explain to a layman what this is? It is a test which consists of inserting a thin tube in the vein with the help of a needle. It's best to show to your patients the cannula that you're going to insert so that they are more confident, less fearful. It's important to also ask about allergies that patients may have. And it's always a good practice to tell the patient that if ever you are unable to do it the first time, you might need to repeat the test, and if that is okay with them. Next, you would ask the patient which arm or vein they prefer. Avoid the arm which contains an AV fistula, IV line, having lymphedema or even cellulitis, or the site of a body that is affected by stroke, because that would increase the risk of thrombus. Ask the patient to sit and place the arm on the armrest or table and expose the arm. Now let's come to how to arrange the trolley. You have the kidney tray with a pair of non-sterile gloves. Along with that, you have alcohol swab, which also contains chlorhexidine. You would be needing a 10 ml syringe with a normal saline, which is used as flush. You would also be requiring a few gauze or cotton wool. Now, depending on the situation, you need to choose which cannula to use. Coming to the tegaderm, we have different types of tegaderm that can be used. Some have 2 stickers and the date sticker, some have 1 sticker, so make sure that you have read the back of the tegaderm about how to use it. Next, you have, if ever you need any IV fluid or sample tubes, place it in the trolley. Finally, you have the clinical waste bin that will be required, and the tourniquet, as well as a good light source. Next, coming to the flush, you need to arrange the syringe along with the saline flush, and then you need to open the tegaderm and remove the sticker and stick it to the tray. Release the cannula in the kidney tray with non-touch technique, and tear off the alcohol swab packet and keep it in the tray, and as we mentioned, the sample tubes or IV fluid if needed. it would be a good idea for you to have a look at how the cannulation is performed, and in the description below I'll be adding this link so that you can get a clearer idea how to carry forth a cannulation. Now, before wearing the gloves, what should you already do? You should wear the apron. Detach two side stickers of Tegaderm and stick to the kidney tray. Stick the date sticker too. Inspect the veins, palpate the veins and apply the tourniquet. Feel for the vein again. Now wash or sanitize your hands. Wear the non-sterile gloves. Clean the area with alcohol swab from inside to outside. And then tell the patient that you're going to feel for a sharp scratch. Next, flatten the wings of the cannula and then with the dominant hand and at an angle of 25 to 30 degrees, insert the cannula. If you go less than 30 degrees, like less than 25 degrees, you might not be able to reach the vein and you might be just pushing the skin, because sharp edge. And if you are going to go more than 30 degrees, you might just go through and through the vein and reach the back wall of the vein. So once you have this angle proper, just insert it, don't palpate the vein again, otherwise you will contaminate that area. Once you see the first flashback in the top of this cannula, lower the cannula, although not completely but almost flat, and keep advancing with the needle in place with the dominant hand for another 2 to 3 millimeters. Once you have advanced about 2 millimeters more, check for a second flashback, so you would try to remove the needle now and see if blood is coming in the chamber that is found lower near the skin. Then push back the needle and keep advancing in the vein. And at this point it is best to try to push the plastic part with the dominant hand further inside, and to pull with the non-dominant hand at the needle, pull it backwards. You need to insert this cannula fully into the vein. You would need to place a gauze piece under the cannula, release the tourniquet, and pull out the needle and throw in sharps bin. Place the white stopper on the cannula and flush the cannula with saline. Now you have the wings of the cannula. Place the two stickers on the side, parallel to the IV line. Now place the Tegaderm on top of this and stick properly so that there is minimum air that is trapped, and stick the date sticker as well. Add the initials of the patient, the date and the signature. Moving on, you would require to remove the gloves and the apron and throw everything in the clinical waste bin. Ask the patient if he or she is comfortable and attach the IV fluid to it if needed, and monitor the rate or take the blood sample if that is important, or if ever you have to inject the medication, but make sure that you have flushed the cannula before doing any of these. How do we end this station? Ask the patient if the patient is feeling dizzy, if there is any excessive bleeding or any burning feel. This may be an indication of phlebitis. Explain to the patient that the procedure is over. However, if ever the patient experiences any pain, swelling, bleeding or reddening of the area, or even notices the kinking of the IV line, please inform the staff. Thank the patient for his or her cooperation and ask the patient if they have any question. It is an OSCE that will be a little bit challenging if you're not used to the Tegaderm, because it is quite sticky. That is why you need to already remove the two stickers and stick it to the kidney tray before putting on the gloves. Another mistake that can happen is the angle at which you are going to insert the IV cannula. And also sometimes students try to palpate the vein right before pushing in the cannula, in that way contaminating the area. Another tip is that sometimes you might find that the vein is slightly twisted. Try to choose a better vein. If you have no other choice, then try to tug on the skin distal to the vein so that you can straighten the vein in that way. So that's about it about IV cannulation. If you have any suggestions, any questions, or you disagree with any point that I made, you're most welcome to leave a comment. This was Matters That Matter. You were watching the PLAB series. Thank you for your time. Like and subscribe. Take care. Bye bye.